UroPatient, tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient. This time I'm coming to you live. This is really me. I'm here. It's snowing outside like crazy, so it's proof that I'm here live. Welcome to the show. This is our 100th episode. We're getting here to celebrate 100. That's quite an accomplishment. It's 100 weeks in a row, never missed an episode, and really enjoy reaching out to the community. So if you're joining us live, feel free to add a comment into the comment box or you have any questions. Otherwise, I'll just keep gabbing along here. So if you're checking us out, we do come to you live on YouTube, Facebook, LinkedIn, and X. Any of those places, you can find out more information about your urology health through UroNurse. If it's your first time checking us out, be sure to check out our website at UroPatient.com. Best place to go to learn more about the show. And it's got all of our past episodes. Yeah, 100 of them out there. So check those out. Lots of great information for you patients. Also, our helpful information page has handouts that you can run off, print them out. So you got them to keep notes on or take them to your doctor's visits. They're helpful. That's what they're there for. So yes, it is 100 episodes. Reaching 100 episodes of UroPatient is both kind of a humbling and exciting. Over the years, almost 2 years now, we've explored countless topics from kidney stones and bladder health to sexual wellness and the latest urology innovations, always with the goal of providing clear, patient-focused education. Each episode has been an opportunity to bridge the gap between complex medical knowledge and real-life patient experience, helping you, the listener, make informed decisions about your urologic health. Looking back, the journey has been about more than just the numbers. It's about the countless stories shared, the questions that I've answered, and the connections I've made with patients, caregivers, and healthcare professionals alike. Every interview, discussion, and deep dive has reinforced the mission of UroPatient to empower listeners with knowledge, compassion, and confidence in navigating their urologic health journey. So join me as I look back at some early episodes. So we're going to go ahead and take a quick peek here just to kind of show you where the show started and where we're at now. This is the very first episode. It's not the whole episode, just a little excerpt, but you'll get to kind of see what the very first website I built for this show was like. It was, I started UroNurse because people were watching. I started UroPatient because people were watching UroNurse, and UroNurse is a great show. It's been going for over 3 years now, but it's aimed at healthcare professionals, nurses, physicians, physical therapists, but it's really not aimed at you, the patient, although you're watching it. And I think there's some great information that you get from it. So UroPatient came out of that. Now, here's an interesting story that I haven't included in my statistics page, which I'll show you. I started UroNurse 3 years ago. This almost 2 years ago. UroPatient has now exceeded the number of views of UroNurse. And together, I've had over 1 million views. So we're doing something right. So anyway, let's take a look at that first episode. Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Senese, and I'm bringing this new adventure to you starting today, the UroPatient podcast. Now, you're probably wondering right now, what the heck is the UroPatient podcast? And why is this guy wearing a shirt that says UroNurse? Well, UroNurse was the podcast that I put together over a year ago for healthcare workers, and providing good urology healthcare workers information on how to learn more about their subjects. Now, one of the things I noticed with putting on this show is that I got a lot of comments on the show that were obviously not coming from healthcare workers, but rather from patients. And when I started seeing all these comments popping up, I realized that we're missing something, that there needed to be something that was patient-centered education rather than centered around healthcare workers. So I knew that there was a need for it, and decided that I was going to fill that need with this UroPatient podcast. And that's why I decided to create the UroPatient podcast. You can see it does have a website at uropatient.com. You can check that website out to find out all the information you want to know about the show. Most importantly, you can register as an attendee to see the show. This way here, you'll be able to watch it live. It's live on multiple facets, such as YouTube and Facebook Live. So you can watch it any of those places, and you can get links from our website to watch us live. And you can always watch us later. If you're watching us on YouTube, be sure to help us out by hitting that subscribe button. So that was the very first episode, a little excerpt from it. You can see the graphics and things are a little early times, kind of learned as I went along. I just noticed I had my jacket on. I'm in my studio. It's kind of cold in here today. So I decided to throw a jacket on, but took it off for you guys so I get you the full look. Now, here's almost one of the most recent ones, episode 95. You'll see some big changes. Some of the things that I started doing was working with AI more and creating theme songs for all of my programs, all my podcasts. And I'll go through all the different podcasts that I put on for you guys in a little bit. But anyway, this shows some of the theme music, some of the changes in the openings and stuff. And I started, when I record from slides, putting myself in the slides. I think it's kind of a cool effect. You can let me know in the comments if you like it.
You're a patient. Tune in and see. Prepare your health for you and me. Knowledge is power. Power. We make it clear every Saturday morning.
Welcome, everyone. Today we're diving into an exciting and innovative treatment for benign prostatic hyperplasia, or as most of us call it, BPH. And it's Optilume. We'll explore what it is, how it works, and why it just might be the future of minimally invasive therapy for enlarged prostates. So BPH simply means your prostate is growing larger, but not because of cancer. This enlargement presses on the urethra, causing bothersome urinary symptoms. If you experience slow flow or getting up at night often, you're not alone. Millions of men share this experience. And as you can kind of see from this prostate, see how as it starts to enlarge, it starts to compress the urethra, which is the tube that we urinate through. That's the bladder up there that holds the urine. So as you can see, it's changed quite a bit. I think it's probably much easier to watch, more exciting, I hope. So I like being in the slides because then I can point to things in the slides too. So, but, I'm always learning new tricks and trying to keep this show as interesting as possible, as well as educational for you. Now, let's talk a little bit about how UroPatient is done. So, as I said, it's actually surpassed the number of views that UroNurse had, which is pretty incredible. But right now, we're over at 656 views from our show on YouTube. Now, it's also seen on Facebook and LinkedIn and X. And I didn't go through all those statistics, but they're also pretty good. But YouTube was the main one, so I went with that. The other thing I looked at is different programs. I kind of looked at the top 10 list. These are the top 10 shows. And I do have an excerpt from the very first one. One of the things that I could see from statistics is what things people really, really are looking at. Catheter care, big thing. Tells me that you're not getting the education you need from your doctor's offices. They're busy. I know. I used to work in those. But, I decided to kind of take a quick dive into some catheter care for you guys. And here's the first, the one that's had the most views. If you have a catheter bag and you're wearing a leg bag, you want to hook that up to your catheter. It's this part here, the part that has the little cap here. These caps, by the way, are color coded so that by the color orange, I know it's a 16 French without even seeing the number on it. But it's pushed in like that. They're not a twist. It's just a push and pull. So and they hold pretty well, so they don't screw in. And you're all set to put this on your leg. Yeah, so that was the number one viewed out of all of them. Over 100,000 views. Glad I could help out. A lot of comments that came through. I'll talk a little bit about that in a second, but people saying how much these hints really helped out. This was a surprise. 54 countries have watched UroPatient. So those are a list of the countries. Probably not such a big surprise. More older than younger people watching it. More men than women watching it. Well, it is urology, so what can I say? The comments, this blows me away. So I do try to get to the comments as quick as possible. I do go to every comment and look at those, and usually I'll respond back, but a lot of them have just been encouraging. Hey, thanks, Vic. You always make it easy to understand. Keep up your good work for all of us guys. Yeah, some of them kind of disagree with me when I say things are, not as painful as I think they might have been for your experience. Well, everybody's experience with pain is different. I have a very high pain threshold. Some people don't, but they let me know when they think it's more painful than I said. So I look at those comments too. Now, one of the things I do stress when people send in comments is this is not the place to go for medical advice. It's to go for medical knowledge. You're going to learn about patient information, not what you should do. So I don't answer specific questions about what you should do, but I have hooked people up with, products that they couldn't find where to get it from and things like that. So always feel free to put things in the comments. I do check those out. A little bit about who the heck am I? Why am I doing this? So I'm a recently retired urology nurse. Been a nurse for over 40 years, and most of that was spent in urology. And you can kind of see from the top there, it's me in my clinic, getting ready to do I'm in the surgical suite, getting ready to assist with some surgery. The one right below that is me with a couple of awards. I won last year the President's Award and a best educational award for a lot of the stuff I do here. The other picture in the middle there is me with one of my colleagues. I got the privilege with my being a urology nurse and being involved in SUNA, becoming the president of SUNA and traveling. So I was in Madrid for a conference. So I've gotten to travel the world, gotten to Madrid and gone to Italy worldwide. And I won all the way on the my right hand side is me lecturing somewhere around the country. I've lectured on this well before I started doing this on a podcast. I would do it physically and travel around the country and talk about urology subjects. So there I am in my posters there saying Vic President. Yep, I was president of SUNA. But what you might not know about me is I used to do magic. I was a magician, so here I am performing a little magic trick for the audience. I was also a musician and a nerd, and that's why I'm involved in podcasting, because I just love this. Now, talk about your podcast. So, UroPatient, the one that you're watching right now, my second podcast I came out with, and I think I kind of alluded to the fact that this was spawned by UroNurse, which I never thought was going to work or be anything anyway. So UroNurse was so successful that I was able to start this one. UroNurse was the first thing I started. I was getting close to retirement at the time, and I thought, well, it might be nice to give back to a community that I was involved with. So I've been doing this strong, and thankfully I've got good corporate support to keep the lights on and be able to keep doing this and keep it on for UroPatient. Now, I noticed that there wasn't a lot of education out there, good evidence-based education about sex problems. And a friend of mine, Dr. Jeff Albaugh, is a sex therapist. So we got together and I said, hey, I'll produce it if you'll host it. And he's the host of the Dr. Jeff Talks About Sex and Intimacy. And they're getting close to their 1 year worth of weekly episodes. So every Tuesday night that comes on. If you have a sexual problem or want to just learn more about sex education and sex therapy and all the different things you can do, great place to go. And because I did finally retire, I decided to start something else. My podcast, UroNurse News, is a weekday, Monday through Friday podcast, 5 minutes or less. I'll look through all the different research for urology and healthcare news. So I do widen it a bit because I like to read a lot of these studies and always did in the past. Love doing it now. So now I just kind of get to play, anchor man and do that. So you want to check that out, you can go to Euro Nurse News. If you're on UroPatient, just go back to the Euro News. It'll bring you back to all of the different podcasts. So with that, I do want to make a note here. So it's been my pleasure to serve you viewers with healthcare information to help you get through this struggle. It's always been my goal as a nurse was to kind of help people out, make it easier for them. I always thought if I got really good at things, I could make them less painful, which I think I've been throughout my career, one of the few that can do things with minimal discomfort. I always like to call it discomfort. But also, take the time to listen to people, to understand, help them get through these things, because, it's tough out there. There's urology. I went into it because it's such a fascinating field. It's so technologically driven, and I was always a techno nerd my whole life, and it was just like a perfect fit. Computers and me and healthcare, all of it worked great. So I really enjoyed it, and I continue to do this every week. So next week we have a great show for you. Just going to tell you a little bit about that. Proud P, measure urine flow with sound. You got to be kidding me, right? But no, absolutely. We're going to have a guest coming in. His name is Alex Hughes, who's going to talk about how this works. But Proud P is a program that you put on your phone, and you can actually see what your flow rate is. So maybe you're a guy that's, getting my age, and you think your urine stream is slowed down. Well, one of the things that's really helpful for doctors is to know how fast your urine is coming out. We call it flow rate. Now, typically, the only way you could do that was to go and get some bit of an invasive test, or minimally invasive, we like to call it. But they could do some measurements to see what your flow rate is. Now, in your very own home, you can take your cell phone, load this program on there, and while you're urinating, you just put it next to you on the toilet, and it will listen to the sound of the urine hitting the toilet water. You got to hit the water, and it'll give you the flow rate. And you can bring this into your physician, who can look at it, your urologist, and kind of tell you information. The nice thing is, instead of getting one study like you do if you go into an office and get one, you can get multiple studies throughout the day and see, is there a difference? Some people say their stream is really strong during the day and slows down at night. There's lots of different things that you can get this information. The best part is I partnered with the company that puts out Proud P, and they're actually offering you guys a 10% discount to be on the website. So if you want to upload it and you want to save some money, you can get the 10% off by using our code, and it'll be on our website after the show is over. So that's about it for today's show. Hope you enjoy it. Hope to keep seeing you showing up every week. Like I said, I do record this one just because all those other podcasts, it's kind of hard to be in two places at once sometimes. So it's easier to record it and to be able to edit it and stuff like that. But every now and then it's nice to pop in live just in case somebody wanted to ask a question. I don't see anybody. There's been a few viewers on and off, but not a lot. Nobody's put comments in. So with that, I'm going to go out and shovel some snow, and we'll see you next week to talk about Proud P, that new app that you can put on your phone.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your help for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.